Good afternoon and welcome to the first Soundbites of 2025. It's my absolute pleasure to be joined by Lauren McCluskey of COTA Case Management. As many of you will know, Lauren is an experienced occupational therapist and rehab case manager who has a special interest in amputation injuries. Thanks, Lauren, for joining us this afternoon.
Thanks for having me.
So I think we'll go back to basics really briefly, Lauren, if that's okay. So for people that are watching or listening that don't know, tell us, what is a case manager?
That's always a good question, because I think every case manager might give you a slightly different answer. I think for me, first and foremost, the role of the case manager is to act as an advocate for the injured person to maximise the recovery. And I think if you've got that one thing in mind, that's what you're doing. I think, the skills of a case manager are probably well documented. You've got to be dynamic, you've got to have good communication, good assessment skills, be responsive, be proactive, and the client's got to be comfortable with you. I think, you're an integral part of their life at a really critical time, and you're going to be coordinating all the MDT, all the treatment, supporting the recovery, and helping them to get a better quality of life, the best quality of life they can have after their injury.
Yeah. No, I always say to a client at the outset, really, that the case manager is absolutely one of the most important appointments that they'll make.
Yeah, and I think it's also really good to recognise that it's not just the injured person, it's not just the amputee, it's also their entire family that have often had their lives turned upside down. So when you're instructing a case manager, I think that also needs to sort of be a factor, because often the family require a lot of emotional support, a lot of questions asking. Quite often they don't understand the difference between the rehab and the claims process. So, having that understanding as well as a case manager, I think, can be really important and make them all feel sort of central to the case management process.
And we know there's lots of case managers out there, and you touched on kind of the skill sets of case managers and what a case manager should bring to their clients in their rehab. But what's the real benefit to a client of having an amputee specialist case manager?
Well, another good question. I think, that's my absolute passion. I set up COTA Case Management, or it was LMC Case Management, a few years ago now, because I felt really strongly about ensuring people with complex orthopedic, in particular amputees, have an appropriately skilled case manager with the right clinical background and the right knowledge base to deal with amputations. And I think, whilst I recognise there's a lot of transferable skills across case management, I think amputees in particular have a unique set of complex issues that need that specialist input to make sure that they get the appropriate rehab at the appropriate time. And I think, like, whilst the case manager is working for the client and not part of the litigation team, they also need to understand amputations in the context of the claim as well. I think that's really, really important. And I think without that clinical background and knowledge, it's really hard to make very well clinically reasoned judgments to make sure the client gets what they need. And also, giving that strong clinical rationale and understanding amputations is really important for the longer term. It obviously feeds into what the experts get to know. It feeds into the legal team. So it's all really important to have that knowledge base.
Yeah, because I think, there are quite a few specialist spinal case managers and brain injury case managers out there. But as amputee case managers, I think that the true specialists are quite few and far between, really, at the moment.
Absolutely. And I think, like I say, I appreciate there's a lot of transferable skills, but I think if you don't appoint someone with the right clinical background and previous experience of working with amputees, you can sometimes run the risk of rehab becoming quite prescriptive, not tailored to that individual.
So kind of speaking about prescriptive rehab and the opposite and tailored rehab, that bespoke package that we all aim for, in that ideal world, how soon do you think you'd like to be instructed as case manager?
Oh, the earlier the better, Chris. Yeah, I think at COTA we've been seeing more and more clients come to us in hospital, which is just fantastic because I think, you know, again, it's well documented that early rehab produces better outcomes, you know, and it's in the best interest of everyone
Yeah.
involved as well. So yeah, the earlier the better.
And there's no kind of one size fits all approach. I think there's a bit of a misconception sometimes with amputation injuries. I think you've got this impression of conventional rehab. And in what are the complexities involved in assembling a rehab team, and also kind of what does that rehab look like for an amputee?
Again, you don't want to be prescriptive, so it is individual and tailored to that person and what their needs are. And I think this is again where I really believe having that specialist case management input from an amputee specialist isn't something to be underestimated. Because you can then tailor it towards the needs. You know, an MDT, constructing the right MDT,
Yeah,
is really, really important. You know, they're all going to have a prosthetic team, you know, prosthetist, physio, you know, maybe an orthotist, you know, access to maybe occupational therapy, clinical psychology. There's loads of different things that, you know, people may need to access. But I think one of the big things that I look at is adjusting to limb loss and, you know, all that emotional support around it. So for me, there's also like non-clinical things that I think can be really important. And peer support should just not be underestimated at all. Getting someone in touch with another amputee can be really, really important, as well as ensuring all the right professionals are around them.
yeah. And you mentioned the psychological aspect of it there. Do you think that's something that gets overlooked quite a lot with amputations?
It can do, and I think that feeds into what you were saying about early access to rehab, because I believe if you get early access to rehab and you make some meaningful and quick progress, you know, functionally, you know, the psychological impact, yeah, while still there, still needs to be addressed, but that can have a big impact on the longer term psychological needs of the person, because, you know, at the end of the day, you've got to adjust to losing a part of your body. It's a very, very big deal, and you've got to adjust to a new normal. So I think again that really can't be underestimated at all.
And looking back on your experiences as a case manager and working with other individuals and not just amputees, what's different and perhaps more difficult about assembling that team for an amputee?
I think, you know, everyone, all case managers will say you've got to get the right team in place, and you know that sort of goes without saying. But I think it's really critical to look at the goals of that client. And in terms of the complexities, it could be things like understanding the prosthetic components, being able to give clear clinical rationale to you know what different things they need, maybe various different feet, various different arms, why it's needed, you know, giving that explanation. Sometimes there can be complexities around the residuum itself. So in terms of maybe they need surgery, getting the right plastics consultants, the right orthopedics consultants. Another big one can be pain.
Yeah.
And again, that's something that really needs to be looked at, you know, not just clear pain, but also phantom limb pain. That can be really, really complex, to sort of help the individual navigate through and get the right professionals around them.
And does geography play a part sometimes in assembling that team and kind of finding the people that you need to work with your clients?
I'd like to say no, but ultimately it does. You know, you want to make access to rehab as easy as possible for the client. You know, they've been through a massive trauma, and you don't want to make rehab difficult for them to access. So getting the right professionals as local as possible is really, really important. Although it is a challenge for amputees, and you've got to consider how far they're going. For example, in a car,
Yeah.
they may really struggle psychologically being in a car. They may really struggle from a pain perspective being in a car. And then you've got to work, I like sort of think about the balance of travelling to an appointment versus the benefit that they get out of it. So I think, yes, it does. We'd like it not to, but ultimately it does.
And do you think that plays a part sometimes in clients considering residential rehab?
Yeah, I think it does. And I think it's again, there's sort of a lot of evidence to support from the military, for example, having early access to intensive residential rehab can give a better longer term outcome. It's not always the right thing for every client, and that again is where you need to think about tailoring it to the individual. You know, for some people, it's really important to maintain a level of normality and continuing maybe their role in their family. They may, you know, for example, they may really need to be at home for a certain reason. So it's, you know, yes, it's great, and yes, it does give great outcomes, but it's got to be right for the person.
I think it comes back to there's no kind of one size fits all approach, and residential rehab might be right for one client or patient, but it's certainly not right for the next.
Absolutely, absolutely.
And you touched on the client specific goals and you know, looking at what's important to the individual. Have you got some examples of slightly different goals that your clients have had and how they've gone on to achieve them?
I think for me, it's just critical to address what their priorities are. I think, you know, and I know like within the context of the claim, there might be different priorities going on. You know, there may be different things that maybe as a solicitor that you want. But I think ultimately, for me, it's got to be what motivates that person, and that's what you've got to tap into. And I think if they're going to achieve a good outcome and have a meaningful life as an amputee going forward, yeah, we've got to find out what motivates them. And I think, you know, a couple of examples I've got in particular is I had one client who the ultimate goal was just to be a mum. They didn't really care about walking as such. Yes, they did in the longer term, but their number one goal was being a mum, and being able to fulfill her roles as a mother. I've got another amputee client who was a pretty decent level footballer, and football is the driving factor among the rehab things. They're really not bothered about maybe what their accommodation is, etc. But that's their driving factor. And I think if you can tap into what motivates them and put that at the top of the priority list, then you can address all the other things around it, because they buy into the rehab process, and they're motivated to partake, and they don't just see it as these things I have to do, and they see that as a benefit to them, and it's going to give them the quality of life that they want in the longer term.
And I could talk to you for hours about this, Lauren, and we have in the past. So, but I'm conscious we're on 14 minutes of our 15-minute slot. So you just very briefly there, you mentioned the competing interests sometimes of litigation and rehab. So how important is it to be able to work with the litigation teams on claimant and defendant side with the engagement of the insurer to get those best outcomes?
It is absolutely critical. And, you know, I think I mentioned collaboration in the beginning. Having that early collaboration is in everyone's interests. You know, number one, you're ensuring that clients' needs are met in a timely manner so they can make the best possible recovery. But it is also important, and it's something you have to have in mind commercially, that you've got to manage costs, and you've got to provide clear, strong clinical rationale for why things are being recommended, maybe have the ability to, you know, challenge professionals if you maybe don't agree with the recommendation. You know, I think again that is just so important. And yes, there's competing interests often, but I think if we can all work together as early as possible and as collaboratively as possible, the outcome will be better for everyone.
I think kind of in summary, it's early intervention with that specialist approach, and collaboration is key.
You've hit the nail on the head.
Well, 15 minutes. It's been really great, Lauren. Thank you very much. Please keep your eyes open for the next episode of Soundbites and look forward to seeing you all again soon. Thank you.